All right, then, let's talk about that closed off patient, that person who just suffers from healthcare PTSD. They're in your office, they won't loosen up, right? They're not loosening up. So we don't want to continue without an opportunity to get them to relax. So when we're talking about anodon therapy and the reversal of neuropathy, what we're probably dealing with is a knowledge person, someone who is skeptical, has tried everything before, and just doesn't really trust anything. But they're there, and that tells us that what they're doing is not working. So the first thing we need to establish with this patient is that the reason they feel symptoms is because of the blood vessels shrinking up around the nerve cells and surrounding tissue. This is the root cause of the reason that they feel these symptoms. So when you have someone who's closed off, ask them, it seems like you don't want to be here. Why are you here? Right? They may say, well, I don't know. My doctor told me I couldn't get better, nerves can't heal, this, that, the other. And then just relate to them and tell them, listen, again, in my experience treating so many people successfully, and that of my colleagues across the country who've treated hundreds of thousands of people successfully, if I'm not mistaken, you're here, you're sitting right in front of me. And what that generally tells us is that what you're doing is not working. You're putting Band-Aids on a problem and you're not getting any better. And you're running out of options. So let me ask you a question. Again, can we agree that the reason you feel symptoms and millions of other people is because the nerve cells and surrounding tissue are being starved for oxygen and nutrients? Okay, great. Can we also agree that our body makes new blood vessels every single day? We get a cut and the blood flow comes back, hearts make collateral circulation. Can we agree on that? Okay, awesome. Any of the specialists you've gone to, the neurologists, the endocrinologists, the family doctors, have they ever brought up a term or mentioned a term called angiogenesis? No? Okay. If they say yes, ask them what it is, because chances are they don't know what it is. Well, it's just a big fancy word for our body makes new blood vessels. We do it every single day. And the way the body performs that process is we eat and drink things throughout our day, which give us the substance or the ingredients for a substance called nitric oxide, which is then stored in our cells, and that's the trigger for new blood vessel formation, but it's only released when it's exposed or the tissues are exposed to certain wavelengths of light. So when we go out in the sun, it releases that nitric oxide. Right? But, as you know, peripheral neuropathy is a debilitating condition. It is a progressive condition that will not stop if we're not treating the root cause of the problem, because medicating for pain, depression, anxiety, sleep, and everything else, that doesn't grow new blood vessels. But when you have neuropathy, your body's ability to regrow blood vessels is no way equipped to keep up with the level of deterioration that's going on. It's just too fast. So what we do, and what's used across this country by thousands of providers who've treated hundreds of thousands of patients successfully, is we provide the body with the amino acids and trace elements in abundance. Now our cells are jam-packed with the ability to regrow blood vessels. But even if you could stand out in the sun naked for 24 hours, it still wouldn't be enough, right? So what we do is we use technology that was discovered by NASA, and it's inside the Anodyne device, that replicates the wavelengths of light that release that nitric oxide and start blood vessels to grow exponentially quickly. And you really should understand this, that given our high success rate, we don't just accept anyone into our program. And if you're fortunate enough to be offered a position in my program, what that means is I'm going to expect you to get great results. And again, understanding the confusion and even skepticism people have around the treatment of peripheral neuropathy, let me break down what great results are based on these hundreds of thousands of people. Okay, these folks have been suffering from months to decades with neuropathy. And the vast majority of them, well over 80%, have noticeable and lasting improvements starting as early as 3 weeks, and the rest in about 5 to 6 weeks. You've been suffering for 10 years? What would it mean to you and your family if you could start feeling lasting results in as early as 3 weeks? probably mean everything he would say. Then you can just ask him, is it all right if we go on? So that's how you handle that closed off patient. Don't move on until they relax and they know that you're there to help them, and you're part of a community that has helped so many people. My name is Michael Berenger, BSN, RN. I'm the founder of Max Wellness, healthcare marketing and lead management call center service. And I've been on the front line of healthcare for 40 years. So if you ever want to chat, just look me up and let's get on a call. Keep doing what you're doing. Peace, guys.